I'm joined now by Dr. Saul Levin, the M.P.A. CEO and Medical Director. Thank you for joining me.
Thank you for inviting me to come.
No problem. I want to talk about some of the highlights that M.P.A. has experienced.
Okay. So I think the big highlights that M.P.A. has experienced in this year has been the strategic initiative. And essentially the M.P.A. every 5 years looks at what are the big issues that will meet the members' needs at the M.P.A. So we did that through a whole long process, and we came up with essentially 4 big areas. The first one is under healthcare reform that's going on in the country, is how do we meet our members' needs through education, through research, through ensuring that diversity is also brought into that component as well. So we're going to look at creating toolkits for many of the members, no matter what their practice is, to really work in the new healthcare environment. The second one is going to actually be education, not just education for our members, but also for the public, for patients, and also their families, to work out how we can truly work together in educating them about mental illness. And then the third one is coming down to research. Research is the backbone of where psychiatry is moving to, and psychiatry is in a very good position now for the changes that we're learning now coming out of the brain, as well as also psychotherapies. There's an IOM report that's about to come out. So that's the third one. And the fourth one is diversity and health equity. Very big issue for us. The population of the United States is changing, as is our physicians, psychiatrists, as they go into training. So that's the last of the 4 big issues we're going to be looking at.
Fantastic. What is the strategic plan that you have going forward?
Okay. So what we'll now do is we'll look at all the programs we're currently doing at the M.P.A. and we'll keep those that really work well for our members. We're very member focused in the M.P.A. So it's how do we meet their needs? What makes it good for them? And then those programs that meet those needs we will use and enhance. We'll create new programs, particularly on maintenance of certification, so that our members find it really easy to use. And we have an electronic learning management system that will really help them in the system.
Great. What about partnering with other organizations?
So that is a really big area that I'm very interested in. We cannot do it alone. Together we're stronger, and we have 2 components to it. The first is to reach out to the other organizations. We start with our subspecialties, be it child and adolescent, psychosomatic, psychiatry and the law, and there's literally 22 of them that we reach out and say, how do you and us come together to once again educate our members? And the second one is also into the primary care arena. Clearly with the Affordable Care Act, we have to work in an integrated fashion. And every psychiatrist, when they see a patient who comes to them, be it for psychotherapy, or for medications, needs to relate to the patient's healthcare provider. So we need to work out how do we all work together on that.
I love that, working together, of course. How about connecting with people across the country?
Okay. So the way we do it is once again twofold. The first is we have district branches or state associations which are in the local area, within a state. All the psychiatrists belong to that. So we work very closely with them. We do it from 2 ways. I work with their CEOs to ensure that the materials we produce are valuable to them to use for the members. And if they have something that they need us to help them with, or materials for us, we do it that way. And then our presidents, and our president-elects go out and actually meet with their counterparts and talk at meetings. So it truly is, how do we get our message out to them and they get their message to us that we can really translate across. And we do it through the internet, we do it through tweeting, we do it through any vehicle that we can possibly do to reach our members. And clearly different stages of one's career is different. The millennials like to do it through their PDAs. Some people like hard copy, and others like to do it through our news, our journals and our newspapers.
Well, thank you so much for joining me today, Dr. Saul Levin.
Thank you so much for doing this.
All right.